Alright, so in this session we are discussing the water balance and extracellular fluid osmolality. How would I balance the total body water? I have a very critical relationship between the water intake and the water output. First, let's check what are the different forms of water intake. First form, and that represents most of the water intake, is going to be beverages. Another form of water intake is going to be food. And the third part of the water intake is going to be represented by the metabolic water. And what is metabolic water? Simply speaking, this is the water that gets produced from a metabolic reaction. So if we're looking here at the metabolic reaction through which you're going to be breaking down the glucose to produce the energy in the presence of oxygen, which is C6H12O6, and in the presence of oxygen on here you add 6O2. This will result in the production of 6 carbon dioxide and 6 water molecules. So you see on here the water that we did produce, this is what we consider a metabolic water. So metabolic water, generally speaking, will represent around 10% of the total body water intake. On the other hand, my water output is going to be in the form of urine, insensible water loss through the skin and lungs, perspiration, and through feces. The presence of water with feces is really important because if a person doesn't allow enough water to pass with the feces, this will cause constipation and might end up causing fecal stones. Which one do you think should have been higher, the water intake or the water output? Water intake is the most common wrong answer. Actually, you shouldn't take more water than what you are releasing. Why? Because if you think of it, if the water intake is higher than the water output, so over years you're going to be swelling. Your cells are going to be swelling, everything going to expand. But this doesn't normally happen simply because the water intake is equal to the water output. And you see on here, this is going to be around 2.5 liters per day. Looking at this diagram is showing us the different forms of water intake and output. If you look on here, water intake through the metabolism is representing 10%, compared to food contributes to 30% of the total body water intake, and beverages are representing 60% of the total body water intake. Compared to the output, urine is representing 60% of the water output, and the remaining 40% of the water output are going to be distributed between feces, sweat, insensible water loss through the skin and lungs. Moving on to the water intake regulation. According to what I will decide that I want to drink, what makes me feel thirsty, what gives me the thirst sensation.
Hypothalamic thirst center gets activated by multiple means, but two major factors on here that will cause the stimulation of the hypothalamic thirst center. The first one is going to be my plasma osmolality. Second one is going to be my plasma volume. And those are actually the two main concerns of your body. So your body is so concerned about maintaining a normal plasma osmolality to not have a net fluid gain or net fluid loss. Also, it's concerned with your plasma volume in order to maintain a normal blood pressure. So what happens if I did have an increase in the plasma osmolality? Let's review together what's meant by plasma osmolality. If I have a blood vessel like this, surrounded by cells, where do you think the water is going to be moving? Will it move from the vessels to the cells or from the cells back to the vessels? Actually, we don't have a net fluid gain or loss out of the blood vessels. Why? Because simply the concentration of solutes on both sides is gonna be equal. I have equal osmolarity on both sides of my membranes, so I don't have any net fluid gain or net fluid loss. So if I did have an increase in my plasma osmolarity, the amount of solutes in my blood is higher than the amount of solutes in my cells. So what's going to happen? The fluid starts to move from your cells to your vessels, causing them to shrink. And this is going to be manifested, for example, in the oral cavity, having dry mouth as a result of not being able to produce saliva. Why you're not able to produce saliva? Let's say this is my salivary gland cells. Where do I get normally the fluid in the saliva that I'm releasing? It's coming from my blood. So if my blood osmolarity did increase, this will reduce the ability of the salivary gland cells to produce the saliva, and if I have a reduction in the production of the saliva, this will cause dry mouth. Dry mouth is going to be a very important factor that will be responsible to activate the hypothalamic thirst center. Other thing that the plasma osmolarity will be responsible for, in my hypothalamus I have osmoreceptors, and those osmoreceptors, from their name, they are detecting osmolarity. They are checking the plasma osmolarity for you. So whenever I have a decrease or an increase in the plasma osmolarity, those osmoreceptors will either become more active or less active. So whenever I have an increase in the plasma osmolarity, this will activate the osmoreceptors in your brain and will directly respond by activating your hypothalamic thirst center. The second major factor that will contribute in the activation of the hypothalamic thirst center is going to be my plasma volume. If you remember, your plasma volume is very important to maintain a normal blood pressure. If you remember, what is the mean arterial pressure equal to? It's equal to the cardiac output times the total peripheral resistance. And remember, one of the contributing factors that will affect the cardiac output is going to be my blood volume. So if I have a reduction in my blood volume, what's going to happen to my mean arterial pressure or my blood pressure? I will have a major drop here in my blood pressure. So blood volume directly affects your blood pressure. If you remember, what was the organ that hates low blood pressure from our previous discussions? Yes, exactly, is my kidney. The kidney, in order to filter the blood needs to create enough hydrostatic pressure for it to get filtered in the Bowman's capsule of the nephrons. If you remember, the kidney did have an apparatus that we've called the juxtaglomerular apparatus, and one of the components of the juxtaglomerular apparatus, this was my granular cells. Granular cells, as we've discussed in the previous chapter, will act as mechanoreceptors, detecting the degree of stretch of the vessels, and they will respond to any drop in the blood pressure by releasing a hormone that we've called renin. If you remember, renin was responsible for the activation of the plasma globin angiotensinogen into angiotensin 1 that will then become activated into angiotensin 2. If you remember from our previous chapter, one of the functions of angiotensin 2 in order to increase the blood pressure back to normal is to activate the hypothalamic thirst center. So again, how do I activate the hypothalamic thirst center? First one is going to be by activating the osmoreceptors, also resulting from the increase in the plasma osmolarity. I will get dry mouth, and the activation of the osmoreceptors will both activate the hypothalamic thirst center. Also, having low plasma volume will reduce my blood pressure, and once I detect the decrease in the blood pressure by the juxtaglomerular apparatus, this will stimulate the release of renin. Renin will then convert the angiotensinogen into angiotensin 1, and then will be converted into angiotensin 2, which activate your hypothalamic thirst center. What's going to result from the activation of the hypothalamic thirst center? This will result in a thirst sensation. And thirst sensation will drive you to drink. Once you drink, what's going to happen? If you're looking here on the slide, the water that you're drinking gonna first moisten your mouth so you don't have any more dry mouth. It stretches the stomach, stretches the small intestine, and once the water gets absorbed in your gastrointestinal tract, this will drop the plasma osmolarity back to normal, and of course will increase your plasma volume. So this will reduce the thirst sensation. You don't have more activation of the hypothalamic thirst center. So everything that activated the hypothalamic thirst center now has been reduced. First, starting with my dry mouth, I get it moistened. Drop in plasma osmolarity. Once I absorb the water, this will decrease, and I will increase my plasma volume also when I absorb the water. Moving on to the regulation of the water output. We have mandatory water losses. Unavoidable is going to be in the form of insensible water loss through the lungs and skin. Also, we have an obligatory water loss with the feces, and at least we're going to be producing 500 milliliters or half liter of urine per day, just to ensure the excretion of the different wastes, including the nitrogenous wastes. How ADH can affect my urine formation? If you remember, ADH stands for anti-diuretic hormone. Presence of ADH will prevent the water loss in the urine. So if I have lots of water intake, I want to get rid of this extra water that I'm taking. So what happens to the ADH? ADH levels will drop, and as a result, I'm not retaining water. This means more water will be lost out in the urine, decreasing your volume of body fluids. Another thing that you see on here, if I don't have enough water intake or the water output is high, this will increase the ADH release, and this results in the formation of concentrated urine. What are the factors that will change your ADH levels? The most important factor here is going to be the extracellular fluid osmolarity. Having high osmolarity means I'm not getting enough water. Having low osmolarity means I am having too much water intake. And according to this, I will either reduce the ADH release or increase the ADH release. Other triggering factor for ADH release is simply anything that will cause water loss. This includes fever, sweating, vomiting, diarrhea, blood loss, and traumatic burns. What's common between all this is water loss. You don't even have to wait until you have an increase in your extracellular fluid osmolarity for you to respond by increasing the ADH levels. It's just enough to get any of those on here, either fever, sweating, vomiting, diarrhea, blood loss, or burns, in order for you to start the release of ADH for you to retain water. And again, why would I need to retain water in those cases? For me to maintain a normal blood volume and blood pressure. Disorders of water balance. First water imbalance that we're looking at in here, this is going to be dehydration. If a person had hemorrhage, burns, prolonged vomiting, diarrhea, profuse sweating, water deprivation, or I have diuretic abuse, I'm losing too much water that exceeds the water intake I'm having, so this will result in dehydration, or in other words, a negative fluid balance. Output exceeds the input. How is going to be manifested? This is going to be manifested by having thirst sensation, developing dry, flushed skin. Why do I have dry, flushed skin in response to dehydration? If you remember, the major way by which your body regulates its temperature is by sweating. If this is my sweat gland like this, here, how the sweat gland is going to be producing sweat? Where do I get the fluid from? It's coming from my blood. And the sweat gland filters the blood to produce the sweat. So if I have a reduction in my blood volume because I'm not having enough water intake, what's going to happen to the amount of blood available for the sweat glands to produce the sweat is going to be reduced. We don't want to sweat because you want to maintain this blood volume, to not have a major drop in the blood volume. So this explains why the skin is going to be dry. But why is it going to be flushed? Another way by which the body is going to be responding to an increase in its temperature is by dilating the vessels located in the skin. And by dilating the vessels in the skin, this allows the heat to be released to the outside of the body by radiation. So again, why would I develop, in case of dehydration, dry, flushed skin? Because of the reduction of the blood volume causes reduction in the sweat production. This explains why the skin is going to be dry. But why again is it going to be flushed? Because of the skin vessels will dilate to release the heat from the body by radiation to the outside. What's going to happen in response to dehydration? What's going to be the symptoms? First, I will have some weight loss because of the loss of the water content. Will develop fever, mental confusion, might progress to hypovolemic shock. If you remember, what's hypovolemic shock? Hypo is low, volemia, volume of the emia is blood. So I have a shock, I'm not delivering enough blood to my organs due to low blood volume. So you see on here what's going to happen to the cells in case of dehydration. If in case of dehydration I'm losing water more than getting, so water is going to be lost outside of the extracellular fluid compartment. If you lose water from the extracellular fluid compartment, this increases the concentration of solids in your extracellular fluid and compared to your intracellular fluid compartment. And as we've discussed many times before, water always going to travel from low solid concentration to high solid concentration by osmosis. So water will start to flow to the side with higher osmolarity, means leaving the cells to the extracellular fluid compartment. What's going to happen as a result of this water movement? The cells going to be shrinking. Another water balance disorder is going to be the hypotonic hydration or cellular hydration or water intoxication. All this describes the same thing. So remember this very first day of the gym when you decide to change your life. You kept drinking water and you ended up having nausea. Sometimes it might progress to vomiting, muscle cramps, headache, and in much rare cases might progress to cerebral edema, convulsions, coma, and some cases death. So what happens on this very first day of the gym? You drink lots of water, you're sweating, and this water is a hypotonic solution. What is hypotonic? Means it has lower osmolarity compared to your body fluid compartments. So having hypotonic solution added to the blood, this will result in decrease in the extracellular fluid osmolarity. If I decrease the plasma osmolarity, what's going to happen? Adding water on here to my extracellular fluid, water will be moving from its high pressure to its low pressure inside the cells. And this will result in swelling of my cells. So in this very first day of the gym, my gastric mucosa, my gastrointestinal tract mucosa, are gonna be swelling, so this will result in nausea. Sometimes it progresses to vomiting. My muscle cells are gonna be swelling because of the net fluid gain and the swelling of my muscle cells on here. This will result in muscle cramps. Might have swelling in the brain cells resulting in cerebral edema or convulsions. Those convulsions might progress to coma and death. So how we're going to be treating a patient with hypotonic hydration or water intoxication is by giving him hypertonic saline. What's hypertonic? Hypertonic saline. Hyper, I have extra or high solutes. It's a solution on here that has high solute content, higher than my body fluid compartments. Because my problem is that I have low solutes on the extracellular fluid compartment because of the added water.